Well, good morning and good afternoon again, everyone. Thank you for joining FSMA Friday for February 2022. My name is Aaron Bolshaw, the moderator for FSMA Fridays. Anyone joining us for the first time, quick heads up, FSMA Fridays is an ongoing monthly industry update for food and beverage facilitators, facility operators, QA, safety, compliance professionals. We see you in the crowd. SafetyChain teams up with the Atchison Group to bring you guidance and thought leadership on a host of topics revolving, of course, around the Food Safety Modernization Act. So the Atchison Group's put another really great presentation together for us, very thought-provoking, and I have to admit, it's something I don't really think about that often, but after today, I am definitely going to look at labels on food products a little bit differently. We're going to be talking about the psychology of product allergen labeling. And real quick to just get started, everyone is on mute. However, we do want to hear from you. So on the right side of your screen there should be a little console for the webinar. And if you have any questions, just pipe them in. Use that questions console. We'll get to those questions at the end of our presentation. That'll allow us to get through the bulk of the material. And we're going to stay flexible with our time. We're going to try and get this going in about 30 minutes today. But again, if we go a little bit long because of those questions, no big deal. We've got some time for you. So with that, I would like to introduce today's presenter. Coming back from our January episode, Brent Koblish, the Director of Food Safety at TAG. Again, such an impressive resume, coming back to us from the chilly state of Minnesota. Welcome, Brent.
Hey, it's great to be here with you, Aaron.
Yeah. So, hey, listen, Brent, I was just slacking with Ann, the show's producer here, just before this, and I was telling her the presentation that you put together really had me thinking deeper about how severe food allergies have this kind of stigma about them, right? And I told her I really appreciated the lens you put on this topic. So I'm so happy for you to join us. Why don't you start out though by giving us kind of that high level update of FSMA Friday for us?
Absolutely, be happy to. And thank you all for joining, all 151 of you so far. Wow, this is great. If you listened to me last month, I apologize for joining this month. You have to listen to me again, but hopefully you'll get some benefit out of this short presentation that I think is very important, especially to the community in which we serve, the food allergy community, which isn't so small. But before we do that, just give you some high-level FSMA updates, just to keep you aware of the ongoing saga that is FSMA and compliance activities. Really, if you become complacent over the last 2 years, complacency I've seen throughout industry and in my own career sometimes can be really problematic in terms of being audit ready, being comfortable with how you're operating your facility. Are you getting a lot of questions? Well, why are we changing? This is how we always have done it. Sometimes that phrase can be the death nail if we're not staying in tune with continuous improvement, etc. FDA has recently announced that February 7th, 2022, that it would resume conducting domestic surveillance inspections across all commodities. So as they ramp up, as state inspectors enter your facility, FDA investigators will be entering the facility. Be ready for that. Good time to really reevaluate your hazard analyses, your whole food safety plans, and how you're operating on a daily basis. So keep that in mind. In a January 31st update, the FDA proposed the completion of several guidance documents by the end of 2022. Again, this is guidance documents that we've have expected to be coming ever since FSMA went live, so to speak, and hopefully a number of these will come to fruition by the end of 2022. As you can imagine, these guidance documents are very important, especially as it relates to inspections. As you know, that state inspectors and federal investigators will be looking to those guidance documents to help guide them in their inspectional activities as well, and making sure that you're up to speed on those. Again, I think I mentioned this last month, but sesame, I think is a good update in light of the current topic that I will be speaking about. Sesame has been added to the list of priority allergens by the US FDA. Compliance goes into effect in January 2023. Are you ready? Well, Brent, we have till January. Yes, you do have till January, but are your packaging suppliers in the know in terms of labeling, etc.? So a lot of preparation goes before the compliance date of January. So keep that in mind. It's rapidly approaching and it'll be here before you know it. All right. So as we get started in the topic today, some webinars I've been a part of, some meetings I've been a part of really have taken, we talk about food allergies. Yes, they must be labeled under FALCPA. They must be labeled under certain jurisdictions throughout the world if you're a global food supplier, et cetera. But have you really thought about the food allergic consumer and how they react to these labels? Well, hopefully I can give you an in to what we know and really how food allergies are life-altering for those who suffer from food allergens. No doubt in a crowd this size, we have individuals who are allergic to some food ingredients or have family members or friends that are allergic. And really, I want to give you an in to how they deal with food allergies on a day-to-day basis. This is something they deal with on a day-to-day basis. 32 million Americans suffer from food allergens. But keep in mind, too, that number is just those suffering from it, not necessarily those who avoid. In fact, those who avoid food allergens are going to be much higher. Because if you have a family member that may be suffering from food allergies, the whole family may be avoiding that food allergen to protect that one family member. And so the impact to those individuals that may not buy your product, or the impact from a safety standpoint, is a lot larger than just those who suffer from the allergen itself. But on a day-to-day basis, if we look at some of the instances where these food allergy individuals are suffering, they suffer from bullying, they have high anxiety, depression in some cases, and there's definitely uncertainty and risk. And that's where I want to focus my attention on today's topic. So as we go into the uncertainty and risk, they're driven by several factors. One, adolescence, just being an adolescent. You're getting bullied at school, risk-taking. Well, I haven't reacted to this product before, so I'm just going to take the risk and consume the product. Well, I don't react that badly, so I'm going to take the risk and just consume this product. I've had individuals tell me, well, I'm allergic to shrimp, but every year on New Year's, I have a shrimp cocktail and I'll just deal with the hives. We know that scientifically, sometimes you might have mild reactions for 30 years. And then all of a sudden, on your 31st birthday, you have an anaphylactic reaction. Your immune system goes into overdrive and you have an anaphylactic reaction. And so just because there are mild reactions for some time doesn't mean that that may not lead to a more serious reaction. So these are very serious implications to the food allergic consumer. Many kids, sadly, I think it's 15–20% of kids don't attend birthday parties. It's just very sad how they have to live and how they have to live a very, very protected lifestyle because of the food allergen which they suffer from. Mistrust amongst family members. I mean, you might have grandparents that say that's just a myth. We're going to feed them peanut butter cookies. And some family members may not be educated on the topic, or may just say, you might have an itchy throat. That's fine. We're still going to have those peanut butter cookies, or we're still going to have an omelet. Mistrust of friends that may have betrayed them in the past, can cause mistrust. Retail. They had a bad reaction by going to the bakery in their local supermarket, etc. Food companies, and really especially labels is where I want to focus a lot of our attention, as many of you have a direct line and direct impact to how your products are labeled. or have advice on how they should be labeled. And more specifically, precautionary allergen label. But before I get into that, I just want to do a very quick overview of what we're talking about here when I talk about precautionary allergen labeling. FALCPA requires labeling of the contains, this is usually the contain statement, or called out in the ingredient deck by its common or usual name, as you can see here in this example. But what we're really focused on here in this discussion is the precautionary allergen labeling statement, which is not regulated to a large extent. There are some jurisdictions throughout the world may regulate the wording that needs to be used, but in large part here in the US, it's not regulated. But the food allergic community, you need to realize, views PAL differently. They believe, a lot of individuals believe, it is regulated. So why are there all these differences in verbiage as it relates to this precautionary allergen labeling? Some believe it's mandatory. It has to be used, whether it's there or not. There's legal ramifications. How many individuals have been in conversations where, do we really need to label it like that? Or is this just to protect your rear end from legal ramifications if we get it wrong? I will tell you, there's precedent out there that this does not necessarily protect you legally. And so I think that's a misnomer amongst us as food industry professionals that, oh, if we use this precautionary allergen labeling statement, we're going to protect us from any legal liability that our products may pose as it relates to allergenicity. Variations represent a hierarchy of risk. So if you use may contain on some products, but produced in a facility that contains X, that has differentiating hierarchy of risk. And so some of the food allergic community believe that some are more risky than others based on the verbiage that's used. And also, one of the ways they view a precautionary allergen labeling is that the allergen present is consistent at low levels throughout the whole particular lot or that particular product. So very, very misrepresented views of precautionary allergen labeling. But although it's misrepresented and the belief is misrepresented or not clear, it's very real in how they view your label, which should dictate the risk in your product as it may pose to the food allergic community. If you get nothing else from this presentation, I want you to really, really take in this particular slide, because this should scare every single one of you that produces product or that has your name behind a particular product, because this slide clearly shows risks are being taken. And quite frankly, some of this is akin to playing Russian roulette with food, because the food allergic community simply does not trust the label. And it's really going down. If you look at the left side, that's taken from a 2007 article that I highlight there at the bottom, and the right is taken from 2015. Now your statistical buffs in the audience will see that some of these aren't statistically significant. But when you compare 2007 to 2015, the risk taking that's going on is a lot higher. It's increasing because of this mistrust. Now, a lot of this data is taken from the European community, but I would venture to say that this risk taking is also taking place throughout the world, especially in the US and Canada, for many of the reasons I've already mentioned. And if you look at the variability of some of these precautionary allergen labeling statements, you see that risk taking can increase or decrease based on what you may use in terms of the verbiage you use on the finished product label. And really, this scares me as a food industry, food safety professional, because again, I can't stress enough, individuals are playing Russian roulette with food. And so What is the answer to this? There is no real clear answer to help drive these levels up to a trustworthiness level. There's 100% compliance with not buying that food. But I think there are steps we can take as an industry to help alleviate this stress and this mistrust that many of the food allergic community have in the labels. First and foremost, really, this is a 50,000-foot level about how I view products or new products entering the market, what the steps they go through. And sometimes I joke about this. Sometimes it almost seems like it's 1 month that QA is involved between an idea conceived and startup at a manufacturing facility. Sometimes you get in at the 9th inning of the game where you're about ready to launch a product and it's going, hey, time out. This is the first time I've seen this product. So where do we need to get involved as sanitation and QA professionals? Once the idea is conceived, marketing, R&D, wherever that idea is conceived for a new product or an existing product, a change to an existing product, QA and labeling professionals need to be involved at the outset to help guide the risk assessment as to how this is going to play out in the food allergic community. Obviously, this assumes that you're adding a priority food allergen to the product or to an existing product. But the idea here is that the sooner you're involved, the sooner you can help influence the best approach, not only to the food allergen management of the product at the particular facility in which you plan to make the product, but you can help influence the ingredient deck. You can help influence that last line of defense that, should it be needed, you can help influence the verbiage that may be needed on the finished product so that you get more consistent compliance from the food allergic community to avoid that product, to avoid the risk of them having an adverse health event, which may include death. So we really need to strive in our organizations to really be involved at the outset of an idea being conceived, not at just the startup, not at the pilot plant level, not at just the sustainability level in the marketplace, but at where the idea is conceived. So how should you approach food allergen labeling? And really, this goes back to Food Allergy Issues Alliance. Now, some of you may be going, I'm not aware of this. Well, yeah, you probably aren't aware of it, and you should be aware of it. This was a group formed of very, very senior level, industry level executives who understood the importance of making sure the consumers are trusting the label, making sure they are following the label's guidance of avoiding said food if they are allergic to an offending allergen in that product. Now, it's very important that all 4 of these criteria are met before you use a food precautionary allergen labeling statement. Again, I can't stress enough, this applies to precautionary allergen labeling and not what is required under FALPA. So please keep that in mind. But when these 4 criteria are met, you should very much consider, and it behooves you to use precautionary allergen labeling as the last line of defense to protect the food allergic community. Whether the presence of a major food allergen is documented through visual examination or analytical testing of the processing line, equipment, ingredient, or product, or other means. Again, this is why it's very important to get your sanitation experts involved to really understand where hang-up points may be, how your equipment works through producing the product, etc. Those hard to reach places that you may or may not be able to get to from a sanitation perspective are some of your biggest risk factors out there. That's why a diverse set of experts need to be involved to really understand this particular bullet point. Whether the risk of presence of a major food allergen is unavoidable, even when current good manufacturing practices are followed. Labeling in lieu of GMPs is against the law and needs to be avoided. whether a major food allergen is present in some, but not all of the product, and whether the presence of a major food allergen is potentially hazardous. So your risk assessors, your toxicologists, your allergen experts need to be involved at the table to really understand the risk at that particular level to the food allergic community. Presence is just presence does not mean it's necessarily a risk. And meeting one of these guidelines is not reason enough to use a precautionary allergen labeling statement. All four need to be met. Again, I can't stress this enough. It's part of your FSPCA training if you went through that process to become a preventive controls qualified individual, but labeling in lieu of GMPs is against the law. And now I've heard people say, well, you know, we really can't clean, so we're just going to add pixie dust ingredients. What do I mean by that? Pixie dust ingredients are those ingredients you add just a tiny amount that really adds no value to the product, but because it's on the ingredient deck, you don't need to clean. Is that really the right thing to do for the allergic consumer who's already going to the marketplace going, geez, this whole aisle I can't even consume because it's either got a contain statements or it's got a precautionary allergen labeling statement. And so is that really the right thing to do? I understand why some individuals approach that question to add a quote unquote pixie dust of ingredient at the end so we don't have to clean this line because it's going to cost X amount of money for the corporation. It's going to cause 3 days of downtime, et cetera. But it's really not the right thing to do for the allergic consumer who is already skeptical and mistrusts a lot of the labels and who continually finds themselves going, geez, I don't have the options in the marketplace for my diet. And so really think about whether or not that is the right thing to do. In my opinion, it's not. And so having a robust conversation about how you can avoid using or going down this path is very important from a trust standpoint and the right thing to do. I'll leave you with this. It's so scary when your child has an allergy because it's literally life or death situation. You can't substitute something else. You just can't. Avoidance is the only way you can eliminate your risk. Now, if you were on the call last month, risk is not zero. There's no such thing as zero risk. But to really drive down risk in the food allergic community, avoidance is the top priority of that community. So really consider the psychology, the bullying that food allergic consumers go through, the mistrust they have in a lot of their family members, but as it pertains to this conversation, the mistrust that a lot of food allergic community has towards industry and how we can help alleviate that mistrust by going the extra step, using these approaches to help bring the food allergic community back to trusting the label once again. Again, it's going to take a long time. It takes 30 years to build a brand and 30 seconds to destroy it. I realize that, but we need to start somewhere to try and start garnering that trust again. And through the label is one way we can start doing that. So thank you, and I'm really happy to take any questions.
Yeah, very, very good, Brent. Like this is, it's not just the right thing to do. I think that one, you've covered this brilliantly, but I think in a market standpoint too, when if you look at your CPG brand as something that you have to defend and also promote it within the marketplace, trust is that sort of pin that keeps it together, right? And so it's not just doing the right thing for allergic folk. It's not just doing the right thing for the law. It's also in a market space where things like this matter more and more. I just look back at the rise of sort of the gluten-free sort of movement, if I could call it that, I guess, from some time ago. This is not new. the tolerance for the labels, and I guess just in general, Brent, what are your thoughts on the market space's move towards really understanding what's in their products, right? By way of whether that's organic, gluten-free, or stuff like this. How does that play into this, the overall market perception, right? What would you say to somebody that's about to do a new product development and go through with those steps you're just talking about, right?
Well, that's a loaded question, Aaron, unfortunately, because you started hitting the nail on the head in terms of gluten-free. Now there are individuals who have to avoid gluten because they have celiac disease, but there's also a large group of individuals who views gluten perceptually as something they need to avoid from a nutritional standpoint, et cetera, not necessarily a safety standpoint. Yep. And so, what I've heard from multiple CEOs is, we need to provide choice in the marketplace because we have consumers who want this, that, and the other thing. I think ingredient labels through smart label, et cetera, are becoming very transparent. You look at a lot of the blockchain initiatives about, where your turkeys have come from, what farms, et cetera. I think those are all good. But if we go back to the food allergic community standpoint, you have 32 million Americans. And like I said, the ripple effect of that, and I can't take credit for that coined term, that's Ann Munoz Furlong, who founded Food Allergy and Anaphylaxis Network, that now is known as FAIR. But the ripple effect of that is millions more Americans are avoiding it because they have a family member or friend who avoids it and they don't want it, that risk in their cupboard, so to speak. But if you're adding an allergen to a product and you have to label it in the contain statement, you're now removing that from millions, possibly millions of individuals who prior to that were consuming that product. And so, and now if you're adding a precautionary allergen statement to a whole group of SKUs that are produced on that same line, you're now removing that product again from their market basket, so to speak. So the volume, the volume aspect from like a CEO standpoint, now you've removed that product from their supermarket basket and you may not get them back. So yes, from a market standpoint, we could talk about the marketability and why it may be detrimental to your bottom line in terms of volume. But here I chose to obviously focus on the safety, what goes through the mind of the food allergic consumer. Many people are taking risks, et cetera, but there's a large group that still don't take that risk, and it's going to impact your bottom line.
Yeah, that's it right there too. Because if you can't convince that it, or be convinced that it will actually affect your bottom line, then change is sometimes hard. So, Brent, we've got a ton of really good questions. Let me get to some of these. I really do appreciate this. So we've got a couple of questions, and I'll just kind of preface all of these questions by saying we are not offering legal advice, right? These are opinions, but I do want to remind anyone that if they do have some needs in their product development cycle or their labeling, and they really need to get scrutinized deeper, please reach out to the Atchison Group. They do have resources. They do have, even lawyers on their side that can really help you out. But for now, we're just going to go through a few of these questions. So one, Mike asks, what do you think of adding a small amount of an allergen and declaring all allergens in the product to make changeovers easier? That's a hack. I could see that. What are your thoughts on it?
Yeah, that's what I mentioned in slide in terms of the pixie dust ingredients. Yeah. I don't think it's the right thing to do for the allergic consumer, because now you further alienated that consumer base from your product. I understand why the discussion comes to fruition around a table to make life easier for the plant, to reduce downtimes, et cetera, et cetera, et cetera. But is that really the right thing to do? Oftentimes I found when you get a really good group of experts together around a table, you figure out a different solution rather than adding a small amount of ingredient. Quite frankly, I believe that's frowned upon even at the regulatory level, because if that ingredient is not playing a functional role within the finished product in which it's added, then I think you have a labeling issue as it relates to labeling in general. Again, it may depend on the product, et cetera, but going back to my previous point, it really comes down to what's the right thing to do for the allergic consumer. And I bet if you get a number of individuals around the table, you would find a different way through scheduling, let's say, through moving products around from one facility to the next in terms of production, et cetera, that you can find a way to eliminate that from being an option with regards to your particular SKU or portfolio.
Mm-hmm. Yep. Good. We've got a really good question here, Natalie. We're talking tree nuts here real quick. Thoughts on labeling refined nut oils? So she says almond, coconut, walnut, for example. The refinement process means the resulting oil is left virtually free of allergenic proteins. She just wanted your thoughts on being exempt from allergen labeling. What are any advice there in general?
Well, FALPA, that's one of the exemptions that Congress put into FALPA, is that highly refined oils are exempt from allergen labeling because, as Natalie rightly points out, if they're highly refined, meaning they go through the refined bleach and deodorization process, they are simply devoid of protein or have a level that is so insignificant it's not going to cause an adverse health event to the food allergic community. So highly refined oils are exempt from FALPA labeling. And so you can take that to mean that, you wouldn't be using precautionary allergen labeling as it relates to refined oils either.
Yep, good. All right, so here's an interesting one. This is very opinion-based again, Brent, but I like these thoughtful questions like this where it's not necessarily, hey, how do I do this in my food facility, but a little bit more general. Sonia asks, do you think over or underuse of PAL is the bigger issue?
Oh, without a doubt, over.
Mm-hmm.
It's so proliferative out there that because we've become such a litigious society. No offense to any lawyer professional or the legal professionals on the call, but we've become such a litigious society that somewhere along the line it said, well, if we proliferate and overly label our foods from a precautionary allergen labeling standpoint, we're able to mitigate any litigious impacts or regulatory impacts to our brands. That's not necessarily the case. I'll give you an example. Up in Canada, there was a recall that happened because on the label it said may contain traces of X allergen. I forget which allergen. When Health Canada or CFIA tested the product, it contained, I believe, over 1,000 parts per million of that particular allergen. Now, the organization at the time said, well, yeah, but it was precautionary allergen labeled. They said, yeah, but it's not traces, it's in there. And so that's an example, a real life example of where that really didn't help them out. And so I think this thought of over an abundance of labeling of PAL is somehow going to alleviate any regulatory or legal concerns downstream, and that's not necessarily the case.
Yeah, very good. So here's a good one about sort of that unintentional side, right? So if I can find it, I just lost it here. Oh yeah, so Goyle asks, how about unintentional and unknown allergens that might contaminate product? Good example he gives is fish allergen in seaweed. Any comment there?
Well, is fish allergen in seaweed? I don't know the literature well enough on that particular question. I would surmise that no. I mean, just because it's in the sea doesn't necessarily mean that there is a mackerel protein or swordfish protein that has contacted that seaweed, unless that supplier is producing fish protein isolate or something on the same line they're producing the seaweed ingredient. So just because it's in the same aquatic environment doesn't necessarily mean that it's going to have cross contact with fish proteins. However, that's just an opinion. I haven't looked at the literature. I don't even know if there's literature to answer that question.
Yeah, that's a
But
tough
it
one.
goes back to that criteria that I outlined of the Food Allergy Issues Alliance. And that is one criteria to determine is if there's cross contact within the supply chain and you know that cross contact through testing or just based on common knowledge is there, is that solidifies one bullet point. You know it's there. Now the other bullet points is it present at a level that could cause harm? Is it persistent in some but not all of the product? You know, these types of questions that pertain to the other 3 bullet points as outlined need to be answered as well. And so, you know, I can't stress enough going through those 4 bullet points, making sure those are answered from a risk-based perspective, and what the answers are to those questions will help you dictate whether or not precautionary allergen labeling should be utilized.
Yep. Good. I'm not kidding, Brent. We still are having great questions come in. So I'm going to ask a couple more and we'll wrap this up. But Leanne's got a really good kind of like on the other side of the coin sort of here. She wanted any thoughts you had on the allergen free and allergen friendly, and she puts in quotations claims, right? Any thoughts in particular on allergen free?
Yeah, I have great thoughts on that. One that should be very, very, very hard looking at whether or not you want to use that particular claim. Many of those claims, if not all, I'm not aware of an allergen-free claim that is regulated from a definition standpoint. Now we have things like gluten-free, you know, less than 20 parts per million. You know, we have other definitions of free from XYZ, right? Allergen free, I'm not aware of any definitions as it relates to that. So you have a regulatory problem right there, meaning that if there is no definition and you're saying allergen free, it means 0. Well, what does 0 mean? 0 is infinite. Can you find it at parts per trillion? Maybe. You're not meeting the claim. But more importantly, from a safety standpoint, that is very hard to manage up and down the supply chain, let alone in your own facility. Even if you have a facility that is quote unquote peanut free or cashew free or, you know, pick your allergen free, it behooves you to do testing. And sometimes that testing is going to be more detrimental to your to the bottom line in terms of the cost of testing for that particular allergen to meet a claim than the actual expected result of that particular product in the marketplace driving significant growth, because the management around of ensuring free from is the bar and the hurdle is so high that it's almost unmanageable. Yeah. Take into consideration too, if you call out a specific allergen, let's say you say, oh, it's free from walleye protein. Well, there's no specific test for walleye protein. And so you have to understand that maybe there aren't certifiable test kits to ensure you're meeting that label. I frown upon allergen-free claims, to be honest with you, because again, the hurdle is so high to manage that it's almost impossible to attain. And any adverse health event that may occur from that product is going to be heavily scrutinized by industry groups as well as regulators alike. So it's very hard to make that claim, and there's no regulatory definition around that claim either.
Yeah, I think I'm so happy, Brent, that you tackled this. There's a lot of ambiguity here, and we can see it in these questions. There's a lot of them coming in. I'm going to take a couple more. One of them is really good, though. Augustin said, great presentation. I'm a little confused on labeling in lieu of GMP, so I slid back to this slide for us. Brent, could you explain a little more as to what that is, labeling in lieu of?
Yeah. So let's say you're producing a product and you're going, it's gonna take us 2 days to take apart the line and clean it. We're just gonna cross label because we don't want to do it. That's in lieu of GMPs. You had so that's what I mean by that. I mean, straight up is
you don't want to
you just don't want to clean. You don't want to put the time and energy and resources into cleaning a line to mitigate that potential allergen to the next particular product that's run on that line. If an outside auditor inspector comes in and says, you can definitely take this, why are you cross labeling? You're going to have to justify that cross label scientifically, and you're going to have to justify it in the sense that you're not able to clean the line adequately, and therefore we've had to cross label. But again, it goes back to those 4 bullet points of when you should cross label. Just saying you don't want to clean the line or you don't want to have 7 days of downtime to clean the line, it is not reason enough to cross label. That's what I mean by that.
Yeah. Thank you for recovering that. That's good. We're going to end this. There's actually someone that had a really good story that shared in this, and I just wanted to I wanted to just go through this because it's a good reminder of exactly what happens, right? So thank you for writing in, Harris. I recently went to a small retail oil and vinegar blend shop to get a gift for a friend. I sampled in very small amounts, about 7 different blends. I ended up buying a bottle of oil and a bottle of vinegar for myself to mix as a salad dressing. I had an allergic reaction about 4 hours after my tasting and 3 hours after my salad. The reaction, was moderately manifested into hives over my face, neck, and scalp. My breathing concerns reduced through use of Benadryl and an inhaler. A trip to my medical provider resulted in steroids and additional inhibitors. After 2 days, the symptoms continued to get worse with significant breathing problems and large hives over the entire body. I went to the emergency room and spent 3 days, okay, while they continued to try and control his results. I could not give them the ingredients since there were no labels on the repackaged bottles nor the tanks that they were poured from. I really appreciate that, Harris, because that's just a reminder. This is real, right?
Yeah.
I know that we all have production concerns at the end of the day. Like, we've got to get in there, we've got to get our stuff and make it and get it out and make it safe. And making it safe is good. But just keep in mind the stories that are actually out there of the allergic folks. Keep them in mind. So Brent, any other final words?
Yeah, I mean, that's man, a sad story. I'm so sorry to hear that a listener went through that and is still going through that, trying to figure this out. But that highlights the real concern that individuals go through on a daily basis. Going to the grocery store isn't as simple as going in there, going down this aisle, grabbing what you need and leaving. Reading every single label on everything they put in that cart. So a 30-minute trip to the grocery store becomes hour and a half, 2 hours. And then there's also a concern, did I pick the right thing? Did I pick up the wrong package? Did I do this? Am I going to harm my child? Am I going to harm myself? So these things are real. And this is 32 million individuals just in the US. That is not a trivial amount. So glad to join you. Glad for all the questions, great questions, and really happy to help out through TAG in any way that I can.
All right. Well, Brent, thank you very much. And thanks to everyone for joining us. I know there was a lot of questions we didn't get to, and if yours is one of them, we do apologize. We will try to follow up though, and keep coming back to FSMA Friday. We like to see you here. You are the people that make FSMA Friday. Remember that these questions that you have are an essential part of this community that we have. So please keep on coming back, and we'd love to see you next time. We've got a couple things coming up next week and the week after. 3 key methods to unlock continuous improvement. That's going to be a fun one. And then March 17th, leveraging OEE to minimize downtime, maximize performance. I know, like, wait, what is that? That's not even food safety stuff. However, if you really think about it, FSQA professionals have a big impact on the output and productivity and yield of your plants. So let's work together on that. So I really appreciate everyone's time today. That's what we've got. Brent, as always, man, brilliant. Thank you so much again.
Thank you for having me. Have a great weekend, everyone.
Yeah, cheers. That'll do it for us for FSMA Friday today. Take care, everyone.